Greetings, everyone. Can everyone hear us? Any thumbs
Yes.
up? Excellent. We had some technical difficulties getting online this morning. My apologies, but it is 10:30 and I want to get us started. Welcome everyone to the Spokane County Regional Interlocal Leadership Structure Meeting, or SCRILS, it is commonly known. I am Justin Johnson, Director of Spokane County's Community Services. And it looks like for the most part, we have everyone who has indicated they will be joining us. If you haven't already, please put your name, title, and organization in the chat, and we'll keep track of attendance that way. And without further ado, I'll turn it over to our host, Commissioner Mary Cooney, Chair of the Board of County Commissioners for Spokane County.
Thank you, Justin. Sorry that I'm virtual today, but I just want to say thank everybody for being here today. It's beautiful weather over here in Spokane. We're almost to the summer solstice, so it's a great time of year to be here, and I'm sure anywhere. You guys I know over on the west side have had record-breaking temperatures, here lately too. So I just want to say thank you. We know this is such an important meeting for us all to be attending and listening to. And so I look forward to, I think the agenda is a great agenda today. As we know, quarterly, there's lots that is happening in between our meetings. So I will be turning over to Justin to let him lead the rest of the meeting. And I just want to say again, thank you for everyone for being here.
Excellent. Thank you, Madam Chair. I will be facilitating the meeting. We will be checking the chat for any questions. We'll be going through this. I know that this also got scheduled over the Behavioral Health Conference. So some may be joining us from the Behavioral Health Conference, as well as a lot of your staff being out. So we'll attempt to get through the agenda without any significant delay, and also answer any questions that may come up. For any of our new partners that have joined us, because we had received some inquiries in advance of the meeting about individuals wanting to attend and see what the SCRILS is about. As a reminder, our SCRILS was a joint agreement in conjunction with the state and local leaders with transition from integrated behavioral health services with medical services back in the 2016 to 2019 period that helped transition and ensure and inform the community and allow for local leaders to be able to have direct involvement with that transition process and to give feedback to the state and the state to give feedback. Since that time, that statutory requirement that created this no longer is in effect, but for our region, we decided to continue this group because of the benefit it provides to our region. So truly, SCRILS is designated for the information sharing, the identification of challenges that may be impacting regionally, and looking at solutions as we look towards the future of behavioral health and the corresponding integration with medical services on individuals' well-being in the 6-county region of the Spokane Regional Service Area. So without further ado, if there's no questions on the history and background of that, I know the state has some individuals on and they are very busy. So I'll turn it over to the state for any quick updates. What we have currently, the request for state legislative updates, and then anything else that HCA would like to share on the potential impact. So Jason, you and your team.
Hey, Justin. Good morning, everyone. Thank you. And I believe Teresa's on as well from HCA. Thank you. And Teresa, happy to also defer to you. Do you want to start us off with anything, or I was going to cover some federal updates particularly. And also, of course, happy to touch on some of the state budget issues. Teresa, do you want to start us off?
Actually, Jason, why don't you start off with your items, and then I can we can talk about what updates I can provide. I do have a slide deck that we could go through, but I wasn't sure if that would be helpful.
Great.
So
great. And I wasn't going to share the slide deck, although Justin, I'm happy to, but cognizant of time this morning, I just put it in the chat. Called Medicaid in Washington State, which gives you and everyone, it's available on the Healthcare Authority's website, a good snapshot of not only what Medicaid is, but then can get into certainly some of the impacts of some of the congressional legislation that's out there now. Senate is considering this, and it's passed the House, and it could be, depending, of course, what precisely passes, very impactful for Medicaid, particularly eligibility and the number of people we would cover for Medicaid. Some estimates show as much as 200, as much as 400,000 people may lose coverage. Of course, there's lots of dependencies there about how things are implemented. What are the final passage requirements of the bills? What are the CMS requirements that they would define for certain provisions? There are many different elements. So this presentation gives a good snapshot of that. And again, I don't intend to go over that today unless there's deeper interest in that, but it's certainly available for you. And again, I put it in the chat for your reference. I mean, for example, the legislation would require work requirements for adults on Medicaid without disability, although there is some question mark about how to define that. And then there are cost share provisions and a number of eligibility related issues. More frequent eligibility checks and redeterminations. Many changes related to that are really that would really reduce eligibility overall by the mere administrative burden of having to go through many different eligibility requirements, workforce requirements, cost sharing. If people fail to pay their cost share, they may not be eligible for Medicaid and things like that. Work requirements and cost share will be very burdensome to administer as well. So there's concerns about that. In addition, on one hand, it's fortunate that there is no overall sweeping federal a change to how the federal government will pay for Medicaid and its share. Many of you already know this very well, but as a reminder, Medicaid is a joint state and federal program. Generally speaking, it's a 50-50 finance program. The state pays 50, the feds pay 50. And there's been a lot of conversations about the federal government paying less to states in Medicaid. There is no general provision about that, but for states like Washington, who have coverage for people who are immigrant health care coverage, not qualified for Medicaid, we may be penalized upwards of 10% of our federal costs, federal financing. And so that is an incredibly concerning issue. That could amount to as much as $400 to $700 million of federal penalty to the state of Washington. So that is something, of course, I think our state legislature will have to grapple with if that provision passes in the final congressional bill. And I cannot predict how Washington State would finance that significant of a gap in Medicaid coverage. So that is one major item we'll have to grapple with, and then many other eligibility, workforce work requirements and cost share requirements that could be very impactful for eligibility. Let me pause there again. That's a reference document in the chat for you, and Justin, I'm sure you can send that around, and again, available on our website for public use. Let me pause on federal updates. This is what's taking a lot of our time and effort, and as you all are probably reading news as well, I understand Senate is trying to pass that before the July 4th holidays, so we'll see what happens, but I know lots of debate underway now. Any questions or thoughts on that?
Jason. Can you hear us?
Yes, I can hear you just fine, Justin. Thank
Excellent.
you.
Sorry, we're still dealing with our internal technical issues. Question on kind of in an aside to the CMS and Medicaid. What about SAMHSA and SAMHSA funds? Any impact on the federal?
Well, Teresa might have, yes, Teresa might have some detail on that. Generally, as I understand it, through this congressional bill, no specific impacts. Again, the Medicaid eligibility and the braiding of some of those funds may certainly, we would expect to certainly see some impacts in addition to some of the administration requirements or actions to basically eliminate the administration may have some more significant impacts. And of course, I think there's some of these grants that they've stopped. Teresa, do you want to take that one?
Yeah, thank you, Jason. Good morning, everybody. Teresa Claycamp. I'm one of the deputy directors within DBHR. I wish our director, Tisha Kirschbaum, was here this morning. She is traveling and wasn't able to be here. I don't have super definitive information, but I will say my understanding is one of the things they're looking at is instead of having separate block grants, mental health, substance use, of combining block grants and having one block grant. That is something that I have understood as proposed. I think there could be pros and cons to that. And then I have, of course, there's concern that there would be a reduction, but nothing definitive. And again, Tisha probably has more information. She was back in DC earlier this week at a national gathering. So she's not here to give you guys more information. The more to come.
No, I appreciate that, Teresa. I know this, it's an ongoing communication back and forth with what's going on at the federal level. So just being aware that there is communication, and if and when that is forthcoming, be able to have that available is great. Jason, the other question I have is, as we talk about federal impact, well, the federal proposals that could impact Medicaid, do you have any idea on what that impact might look like to community hospitals? A lot of our region, first access or even critical access for any service, including behavioral health, is our community hospitals.
Yeah, I think it could be, again, severe access issues overall in the sense of loss of funding, loss of eligibility, which again results in loss of funding. So I think we could see some significant changes. I'm looking now to see, I know we've got some good slides in this deck that that might be helpful. Let me see here. I'm going to share my screen on some of this. Yeah, here we go. Here's rural health. Here's hospital. Let's just see if I can share this real quick. Again, this is in the slide set, the link I included. So, hospital care generally in Washington. So this is just a snapshot of what we currently pay. And of course, there's no direct sort of estimate here, Justin and everyone, about how much would be lost in payment, but it's sort of a trickle effect. In other words, a loss in eligibility creates a loss of funding for the people in Washington overall. That creates less funding situations and problems for coverage. Here's a snapshot of community health centers, of course, many in rural centers as well. School-based healthcare. Here's a snapshot of rural healthcare in Washington. And I'll pause it here for a second so you don't have to see me scroll through everything. But here's some maps of some of the impacts as well. So by congressional region in Washington State, here's your Medicaid overall population. This is the adult enrollment, so basically taking children out and other categories, pregnancy category, I believe we've removed from this. Child. And then, here's an issue that I think we can't ignore either. Medicaid really is and has been chiefly pregnancy, children, and people aging with disabilities. And so the impacts here can be broad on all of those categories based on eligibility standards. So we cannot ignore the importance here. And of course, a major rural issue as well. So anyhow, that's available for you all, and appreciate the question, Justin. Happy to stand for additional.
Yeah. Just for timeline, if based on the document there, the projection for any proposal that does get passed on the federal level goes into effect, when should we see, or when would we expect to see potential impact in our communities functionally?
Yeah, it's variable depending on the provision, and of course some of those dates have changed over the passage of the final bill. I'll just share one, for example, is the work requirement provision is a 2027 timeline. So I believe that's a July 2027 implementation. And we have the 10% penalty, I believe also is a 2027 implementation. So the theory there being, if that passes with that deadline, the legislature then next year may have to make a decision in advance of that deadline about what to do with some of these programming, to whether or not to avoid the penalty or to budget for the penalty, in addition to other issues that might come about, lawsuits and challenges and so forth. So but some of these go into effect immediately. There are provisions for family planning. There's provisions for other treatments that would be made immediately and impactful upon passage of the bill. And that would also reduce coverage and financing related to that. And happy to share another resource. Let me try to find it real quick. Let's see, I think this is it. Here we go. This is from the Kaiser Family Foundation, which is really a great healthcare policy research, and they have a pretty good detailed tracking of the bill up to date. And so for those who are really interested in the timelines and provisions as the bill changes through Congress, they're keeping a good up-to-date tracking on their website, and I'll just include the link for that for you as well.
Excellent. Thank you, Jason.
Well, maybe Teresa, you want to cover some of the state issues, and I might pepper in here or there, but do you want to take it from here?
Yeah, Justin, I've got the slide. There's like 6 slides that and the MCOs have seen and the ASOs have seen these slides. It's basically overviews the state budget high level, and then also does an overview of the bills that were passed that are related to behavioral health. Do you want me to go through that today? I don't know how your guys' time is.
Yeah, no, that would be great. I know a high overview would be great for a lot of people here. I know it's a little bit more complicated on how will be felt in the the months to come. So yeah, if you can give a high overview of it, that would be perfect.
And I'm going to share my screen and hopefully do this correctly. I'm so used to Teams, and so I get a little out of my comfort zone here with Zoom. Okay. Everybody able to see that?
I can see it.
Yes.
Yay. Okay. I'll try to stay high level. There's like 6 slides. So as folks know, legislation passed, sine die was Sunday, April 27th. And the budget was signed by Governor Ferguson on May 20th. And, we're still unpacking a lot of the things that are in the budget for behavioral health. And for folks that, want to look things up, we've got the bill number is 5167, and you're looking for the main section is 214. That number changed because we used to be in a different section. So we were trying to point out that we're in section 214 now, so folks can find it. At a high level, I mean, we honestly were bracing for um, something that was worse. So this is actually honestly not as bad as it could have been, I think. And so for some of the reductions, we do have a 10 to 20% reduction in some of our programs, which are listed there. So you'll see alternatives to rest in jail, assisted outpatient treatment, our jail services through the ASO, so the bridge funding for CCBHCs. There was a reduction in the lead grants. Recovery Navigator program did receive a 20% reduction. True Blood Diversion programs, I believe, was a 10% reduction. Recovery residences and some reduction to the short-term housing. So not good news, but honestly, a 10% or a 20% reduction is better than what we were bracing for in some areas. We did get some additional funding for specific bills, and in the next following slides, I've got some information on what those bills are, but we did receive some new budget items related to some of the legislation regarding 5745, so involuntary treatment council, some funding there for the administrative costs to implement that bill. We also received funding to implement Senate Bill the 1272 for children in the crisis program. We did also receive some funding for a bill related to certified peer support specialists, and then finally the 1813 bill, which is the procurement bill, and I'll have a little bit more details on those bills in the next slides. And I've lost my cursor. So of the bills that were passed, and before I go on, Jason, is there anything else you would want to say about the budget?
Well, the only other major effort, and I think I would just say two, one, the HCA and the rest of the state agencies have a 6% budget cut we have to meet administratively. And of course, for HCA, that really is a 12% cut because half of our funding comes from the feds. So you can't ignore that. So it's been very impactful for just staffing on HCA. We have an incredible vacancy right now. On one hand, fortunate because we probably do not have to do any actual layoffs. On the other hand, we have a enormous vacancy rate. And so I just ask for your patience if things are delayed. We have some incredible staffing challenges in that regard. But the big cut for the system, in addition to the ones Teresa noted there, is what is a 1% managed care cut. That may sound nominal, and it, to some extent it could be, but the fact is a 1% managed care cut is $90 million. And that's on an annual basis, and it's on a going forward basis. So it is not nominal overall to the system when you look at what 1% of Medicaid actually is. So unfortunately, that does need to be done, and we are looking at ways to do that. Now, not every provider will see a cut because there are many groups of providers, primary care, pediatric care, some hospital care, that are otherwise protected. Labs received a separate cut, so labs won't be included. Pharmacy is tough to cut because they're based on wholesale prices and so forth. So we can't necessarily include a 1% across the board, is my point. So there will be some who will see higher percentage cuts than others. We are looking at anything that received a rate increase over the last few years, and taking a look at whether we should roll back some of those rate increases. We are not looking at behavioral health rate increases in that regard. So some of the major behavioral health rate increases over the last few years. However, there are some others that primary care, developmental and screening codes, and low-level behavioral health codes that are more very a low amount overall, but we are working through what might be available, because it's hard to really hit that number of 90 million. And we're taking a look very closely through everything. So we're working through that process now. We'll have better communication out once we have some decisions, and at least with our initial take on what would calculate to 90 million. And then need to build that in by August timeframe for the January one. It begins January 1 next year as part of the rate. So that's the big one we're working on right now, unfortunately.
Thanks, Jason, for that. So I'll go through these pretty quickly. There's just 3 slides, and it just will highlight the bills that are related to behavioral health that were passed. So 5361 is going to impact our substance use disorder professionals and our substance use disorder treatment agencies and agencies. What that does is it delays the ASAM criteria, which is the American Society of Addiction Medicine criteria. It delays us implementing the updated criteria, which is ASAM 4, as well as the adolescent transition age youth version that will be released here shortly. We're going to delay implementation until January of 2028. So that does impact our providers, but the silver lining, it gives us some good time to really hone in on what's needed for that transition and be very mindful and thoughtful with that transition. So there's pros and cons to delaying the ASAM. 1432 actually applies to more of the commercial health plans, including public and school employee benefits. And it essentially updates and codifies clinical standards for medical necessity determinations. It does allow for the use of ASAM, but also permits those health carriers to use additional utilization tools. Usually those are proprietary tools such as Interqual or MCG. There's a proprietary tools that they can use, as long as that criteria is not more restrictive than the ASAM criteria, which is what Medicaid uses. So that one might be one to watch for the SED providers. For 1813 requires healthcare authority to adjust the Medicaid rates promptly and prospectively to reflect increases and decreases in services, facilities, and capacity. Also requires us to make preparations for the reprocurement of Medicaid managed care contracts, and to consider the methodologies for measuring network adequacy and access, and contract amendments to reduce administrative burdens. Requires us to direct managed care organizations to expand their delegated arrangements with the ASOs, and that delegation will now include facility-based crisis stabilization. So that will be a shift, and that shift is required for July of 2026. And then also requires Healthcare Authority to develop a plan for a statewide ASO that serves American Indians and Alaska Natives. So that's also part of the 1813 legislation. 1811 directs the University UW of School of Social Work in consultation with Healthcare Authority and the ASOs to establish a program to administer a crisis responder training academy. So that is one of the legislations that passed. And then our 5745 bill, Involuntary Treatment Council, allows counties to elect to have Healthcare Authority contract with the Office of Public Defense for appointed counsel services on the county's behalf for individuals being detained in a state facility. And HCA must notify a county within 30 days of receiving notice from OPD that appointed counsel cannot be provided through a contract with OPD. Counties receiving such a notice from the Healthcare Authority shall provide appointed counsel either directly or by contracting for that representation. So that is a new bill. And then 1427 refers to the certified peer support specialist. It does trigger the official name change. Peer counselors, certified peers, we've had all kinds of names through the years. It does officially change the name and the credential, if you will, to certified peer support specialist. So that was a big change. Also directs Healthcare Authority to contract for the development of courses to supplement the training of certified peers, specifically as it pertains to domestic violence, sexual assault, and human trafficking. It directs Healthcare Authority to also contract with at least one entity to develop ways to expand access to peer support services through providing technical assistance, particularly when it relates to billing, how to bill for various things, and explore the use of capitated payment arrangements. So there's a lot packed in there. And then also when Healthcare Authority does the reprocurement, requires that the accessibility of peer services in a managed care organization's network be given significant weight in any procurement for Medicaid managed care services. So that's also in that bill. And then just one more slide. I feel like we've taken up a lot of your time. 5128 is the juvenile detention bill, and it basically specifies that Medicaid suspension provisions apply to persons confined in institutions and facilities operated by DCYF, but not county juvenile detention facilities. And it directs Healthcare Authority to collaborate with specific entities to implement federal requirements to provide screening, diagnostic, and targeted case management services to Medicaid enrollees who are under the age of 21 and also incarcerated and approaching their release date. And then finally, 1272 basically extends the Child and Youth Multi-System Care Project Director position within the Office of the Governor and other related programs to address complex cases of children in crisis until June 30th, 2027. So that was actually going to expire. So now it's not expiring. And it basically, as established during a previous legislation biennium, the director is required to implement a rapid care team for the purpose of supporting and identifying appropriate services and living arrangements for a child in crisis, and that child's family in coordination with DCYF, Healthcare Authority, OFM, and DSHS. So that is kind of basically a continuation, correct, Jason, of a previous bill. I got that right?
Yep.
Okay, there you go. That's a fast and furious download of where we're at after legislation.
I guess I might not say a correction. That one, it just extends the work.
Thank you.
The work.
Excellent. That was, that's still a lot to unpack, as you mentioned earlier, and we appreciate that. I know for a lot of the communities that are joining on the SCRILS, being able to get that succinctly and how it impacts behavioral health and its intersection with the medical side is always important and is very valuable for HCA to share on that. So appreciate all the information and the ongoing information, Jason, you and your team have been able to provide us, SCRILS.
Likewise. Thank you, Justin. Thank you, everyone.
Any last questions for Jason or his team, Teresa, for the information they shared, or thoughts about impacts in your region? Going once, going twice.
Justin, maybe one more quick mention
Yeah.
about the Spokane Juvenile Detention Facility. That's ready to go live for our reentry waiver July 1, and quite frankly has done the best of the entire state in preparation, and it's ready to go. So just kudos to Spokane Juvenile. And then looking for rest of the Spokane region jails, potentially and hopefully January 1 next year. And again, this is for the Medicaid waiver benefits. So Medicaid would start paying for services 90 days prior to release from a facility. So should be very helpful, and a great focus on behavioral health, mental health, and of course, SUD, medication for opioid use disorder primarily, in addition to a heightened what we're calling targeted case management for reentry. And quite frankly, the entire pharmacy benefit can be paid for in that period as well. So it's could be quite a beneficial package for local jail. Thank you, Justin, for that. Just thought I'd give some kudos to the juvenile facility and team.
Yes. In fact, we do have the director of that facility, Spokane County, with us today to share on some other information. Her and her team have been amazing. So Tori,
you've been amazing working through
Tori's
all
got
this.
all the
Thank you.
credit, her and her team.
Tori, wonderful.
Great, thank you.
All right, hearing none and seeing no one in the chat. Jason, thank you and your team for sharing today. You're welcome to stay on,
Thank
but
you.
we appreciate you joining us this
Happy to listen in. Thanks, everybody. Have a good weekend.
Excellent. All right, for general updates, we were going to have DOH. I know we had to bump them in the last iteration to give an update for 988, and then they're actually out this month. So we'll be having them come in September to give an update, but we did have Jan and team, well, I guess just Jan with FBH, who is our current regional 988 provider, as well as our RCL provider available. Jan, I wanted to give the opportunity for FBH to share briefly about the work that you do at 988. Any updates that we should be aware of, or how are things going, at least with 988?
Frontier Behavioral Health operates 988 and the regional crisis line. And the biggest thing that we've seen recently has been a shift in the call volume. There's been an increase in calls, and primarily to 988. We see that our community is using 988 more than they are using the regional crisis line, whereas in the past that had just been the opposite. So we're seeing about a 50-50 split in terms of the calls that are coming into 988 as well as the calls that are coming into the regional crisis line. One of the things that we are anticipating that we will add in the next fiscal year is chat and text. Chat and text is available for 988 right now. Frontier Behavioral Health's 988 call center does not have chat and text, but individuals from our community who want to use that way of communicating can use it now. They will just get someone who is out of King County or Central Washington that will receive chat and text messages. But our hope is that within this year, we will also be adding chat and text.
Excellent, Jan. And as a reminder, for those that are here, the regional service area that 988 that FPH currently covers is the same regional service area as our RCL, and they also provide support for the overall 988 system. And for those individuals whose phone numbers may reside in a region, then our in other parts of the state. So there's intricacies here about how they support our residents throughout the state, or those that have their phones registered within our side of the state. And the second aspect, the vertical integration with the RCL 988 allows for the direct ability for them to refer internally for dispatch of teams, as well as out to our rural providers for their crisis teams. So this is a unique aspect that we have in our region that is not as similarly integrated in other areas. So we've had that benefit for some time, and really being able to work with FBH to build that out has demonstrated a benefit to our region. More local engagement and referrals allows for more direct engagement with those residents throughout our 6-county region. Any questions for Jan about 988 or the RCL? Seeing none. Jan, I know this is actually your day off, or was planned to be day off, so I appreciate you joining us and sharing some information and being available for any questions.
Sure, no problem.
All right, now go take that day.
Okay.
Thanks, Jan.
All right. Thanks, guys.
And now we'll turn it over to our next topic. We actually have the director of our Spokane County Juvenile Court Services and Detention Facility here, the resident expert for a lot of the changes that have been going on statewide for the quote unquote, or colloquially known BECA bill, and the funding impact. So I want to turn it over to Tori. The reason we have Tori sharing today is impacts in other areas tend to translate as we feel those downstream. They're not getting benefits or services, or not being or having the same interaction or engagement. We can feel those in the behavioral health world, especially for those that are more acute or have existing behavioral health conditions that are exacerbated by not having the right support at the time that's needed. So I wanted Tori to come and share a little bit about that, which we'll turn it over to her, provide some background and history on what this is and what is now the impact based on recent legislative changes at the statewide level. So, Tori.
All right, thanks, Justin. I am Tori Peterson, and like Justin said, the director of juvenile court here in Spokane. I've been here a long time, 1991. I'm going to talk about a little bit of the history of the BECA bill, the current situation that we're in, what the role of the court is in that process, why the work is important, and some of the impacts. So in 1993, Rebecca Hedman was here in Spokane, placed at a treatment facility, what was a runaway out of Tacoma, a foster home there. She ran away from the treatment facility here, was trading sex for money, and was eventually murdered by somebody here in Spokane, and her body dumped. At that time, the DCYF regional administrator had a 13-year-old daughter, and the youth serving agencies in Spokane, and that includes law enforcement, came together to see how does this happen and how can we prevent these. And largely, Becca was obviously not engaged in school as a runaway. Her foster home was actually a good foster home, so DCYF's involvement was reduced. And she had not committed a crime, so she was not involved in the court system. So the process all shortened, but in 1995, it was the BECA bill that was passed to help address the needs of families and kids that were basically not involved in any of these systems and falling through the cracks. They didn't have the guardrails. So as the bill passed, it had 3 parts to it. It had truancy, which we'll talk largely about today. But it had at-risk youth, which those petitions are often filed by the parents, and that would be what Rebecca Hedman would have fallen under. And then there was the CHINs, and it's child in need of services, and those are often filed by the adolescent or the youth who maybe the home situation is not good, but has another placement that they could go to, and so the court assists in that, and those cases are also case managed. So there's been significant changes in that bill over time. One of them was really incorporating a lot of what Spokane was doing at the time, and it was the community engagement boards and MOUs with the schools to work in partnership. And so that change again, case came out of Spokane, and then a lot of the legislative pieces are based on the model that was being done here in Spokane. Then back in 2021, the legislature took away the ability for judges to confine these youth. Highly debated, it was 5290, highly debated piece of legislation, because as the very last resort, sometimes that confinement was the only situation that may keep these kids alive, which it may have done in Rebecca Hedman's case. So because of our partnerships and the education in the community, Spokane has the highest filings in the state, and so gets the largest portion of the money. And what was coming to Spokane was $1.3 million. And now it takes us to our current situation where it's been $7 million annually statewide, has been reduced to $2 million statewide. And so basically what we're cutting is services to kids. I will say the schools in the truancy aspect do a great job, and by law, they're required to do significant interventions. Once those are no longer successful, that's when the court gets involved. How that happened, this came late. This bill did not follow, or this did not follow the normal process. And so it came very late in the session. And as it turns out, it was based on a lot of misinformation that the work done in truancy, which is actually a large portion of the Becca bill, like 94% of the filings are truancy filings. But the misinformation is that the process is designed, it's just punishment for kids, and that truancy starts in the court system. And that is inaccurate. As a matter of fact, it comes to the court the last thing. In Spokane, 75 to 80% of the cases, once filed, do not even come to the courtroom. It's filed, a stay is put in place, they don't even come to court, a letter goes out to the kids and families, and in 70 to 80% of the cases, with the work done by the school, those problems are solved. But it's those other 20% that tend to be our highest risk kids. And so what do we do with those 20%? Once that stay is lifted, once the kids continue to miss school, then our case managers in juvenile court get involved. And it is about barrier removal. We know truancy is a symptom. And so they're digging in to look at the root causes of that truancy and to remove those barriers. The schools cannot do this by themselves. They're also overwhelmed. My staff go out into the community and connect the kids to the community resources. They're trained in motivational interviewing and trauma-informed care. And so basically they're part of wraparound services for the kids to keep them engaged in school. Why this work is important? Well, we know Department of Justice stats show that kids who miss 10% or more of school, which is considered chronic absenteeism, are 7.4 times more likely to drop out. A lot of research also shows that there's long-term economic and social consequences for school dropouts. Annie E. Casey Foundation has the data, and I believe this is a little bit older, so we can definitely raise this number, that the high school dropout costs the taxpayers an average of $300,000 each. And so keeping kids engaged in school, it's why we do the work we do. So this funding ends July 1st. I should say greatly reduced by 70%. So for us, it means we will no longer be able to case manage those kids. We are fortunate enough to have our VOCC provide some one-time funding to be able to continue this work at least through the summer, or to make the changes that are going to have to be made with a significant cut like that for all the departments involved, to figure out how are we going to get these cases processed and how are we going to still find services for the kids. So we have a little bit of time. For me, I feel lucky, and I feel lucky for the kids and families that my staff can at least get them through summer We lose a lot of kids in transition from elementary school to middle school and from middle school to high school. So they will be able to help with those transitions and a lot of those barrier removals. So the impacts, currently there's 300 kids that my staff are working with doing the case management. The biggest concern is we will not have them in place anymore to get them connected to the services. And I think most of us know somebody in education in one form or another. And what they're seeing in the kids these days, the high needs, high risk, complex issues. And so to lose the ability to get those kids connected to the services is obviously a concern. The kids and the families, a lot of trauma, a lot of hand holding is necessary. And I know I'm talking to a lot of people here who are well aware of this and understand the issues we have here. So the loss of support, it's a pendulum swing, right? We're gonna go back to having kids like Rebecca Hedman again, and this is the history. We have to know, where we've been to know where we are and where we're going. These pendulum swings happen. So, yeah, we're gonna rely on the schools more, and obviously they're taking their cuts. But it's the concern of the number of kids we're gonna have without people with eyes and hands on them. Any questions on that?
Yes, Commissioner.
Yeah, and I just want to say, Tori, it's as you know, we'll be talking more about this on Monday with the commissioners meeting. But it's a really tough situation for all of us. I mean, I know other county commissioners that are on this call, also are having budget constraints, and we just can't continue to pick up what the state, is requiring us to do and has been funding. And we can't just continue to pick up that difference. And I just want to know your team is, doing a great job. We're trying to do everything we can, and we're going to be back advocating. I just had a meeting that amongst like 12 people in Spokane that the governor was at, and mentioned the Becca bill and the funding situation. So we're going to be advocating. And I think we need everyone who's listening to be advocating for this because it is so important. So I just want to put that out there, that it's not, the mean commissioners that are trying to cut this funding. It's, we're in a budget deficit going into 2026, and we have to be cognizant of the other costs that the state is continuing to put on to the counties.
Yeah, thank you, Commissioner. And again, much appreciated the money that the board did provide so that we don't have to immediately cut off services to these kids. And yeah, this was a state cut based on, I strongly believe on some misinformation. And yeah, I understand the unfunded mandates and how those are only increasing. And we're not the only one feeling this pain. This is seen everywhere.
Tori, I have a question on just the outreach that your teams are doing. How many providers this includes behavioral health or any of the resource community engagements, do these teams make on a given month or year?
Oh, well, and they're actively serving 300 now. And so it depends on the individual case and what the needs are. I know we get them connected to the behavioral health system largely. Our biggest partner is Native Project. So that's the hand holding we do, is trying to get these, because they're not going to go on by themselves. And so it's whatever the individual risk or needs of that kid and fit. Sometimes it is housing. They help them find the housing, again, connecting to community resources. Sometimes it's they don't have clothes, they're embarrassed that their clothes stink. I mean, sometimes it's daycare, or they're taking care of younger kids. Sometimes it's severe mental health or drug alcohol issues.
But it'd be accurate to say that your teams connect with whatever resource the kid needs or the family needs to ensure that they're continuing to be successful in their education.
Correct. Yeah. And I would say it's every one of these, because like I said, by the time they get that second filing in the core and the school has done everything, which is also, they've had a fair amount of resources now in schools than they used to. So yeah, it is, these are high-risk kids by the time my staff are working with them, so high needs.
And if you don't have that interaction at this level, who do they think will pick up this slack of being able to meet the needs of these youth?
Because this came at the very end of the session, that is still being figured out. And that's the tragedy in this. I think there's going to be more reliance in schools, but like I said, they can't do it all. So we're gonna need, I don't know who's gonna go find them. For example, just after COVID, OSPI put a moratorium on filings. And when things started to get back to normal and kids went back to school, in Spokane Public Schools alone, there was 500 kids they could not find. And so that's when they called us and my staff who've been out in the community. We're just really tracking these kids down to get them re-engaged. So I don't know who's gonna find them.
And I think that was one of the biggest impacts that we saw when we were discussing this in regards to how they're connected to resources. The fact that this opens up an avenue to have that conversation and do intervention at a critical time where the youth are at the highest risk. With that not there, the community and other resources have to fill in the gap. They don't have the same access and ability to engage the family in the same way that your staff does in regards to this bill. So just reduction of funding significantly reduces the ability to meet these kids where they're at and address the need. Now, I understand they have brought up a lot of challenges regarding how this is implemented. They didn't want to have a punitive system in response, but from what we know and what we've heard about this program, it isn't. Not in the way that it would be to penalize kids, is to ensure that they don't continue to come back in the system whenever is needed.
And I should be clear that the 70% cut, we still, even with that, will be able to fund 2 case managers for the at-risk youth in CHINs. Unfortunately, there's not going to be enough money to provide those services because we do contract out. But again, we'll take advantage of the ones that are out in the community and just not be able to serve some with who we're currently contracted.
Right. Well, a lot to look forward to as we hit July. I know there's a lot of things hitting, and as we discussed, a lot of things to digest to see what the impact will be. But we wanted to put this on the radar, especially as it will be a part of a larger conversation of, to our Madam Chair's comment, there are a lot of budget constraints across our counties. And as much as we have and want to implement the necessary funding to support, the hard decisions are without that state support or funding on that end, we do find ourselves in a challenging position. So we look forward to continuing the conversation of what impact this will have and how we can begin to look at what resources are available to meet that need. At least have that conversation at the table here. I don't see any comments in the chat. No questions or hands raised. Any last thoughts, Tori, you want to share with the group?
Yeah, I think that depressed everybody enough. We'll continue to try to get creative and find ways. Our mission is to center kids and families, and we've done it through budget crisis before, so we'll continue our efforts.
Sometimes hard and challenging information, although sobering in terms of what we're expecting as we look forward, absolutely necessary to continue. How do we address these and bring it forward to what our Commissioner Cooney, our chair of the board, has indicated needs to be an ongoing conversation, not only from counties, but to the state on what this impact will look like. So look forward to that, and as well as the continued support from this group in addressing this critical need. All right. Thank you, Tori, for sharing, and we look forward to actually maybe having you come more.
Okay.
So any other questions before we move on to our next topic? The following topics that we have on there are just updates from the regional BHASO on the behavioral health impacts that we have been working on. That's the component that serves the 6 county region under a contract with the Healthcare Authority, Department of Commerce, and DSHS and various other state and contracted entities. So there are no other questions. We'll jump in. I'll turn it over to Ashley McGee, our Integrated Behavioral Health Manager, who oversees all of the ASO efforts within the 6 County region. Ashley, you want to give us an update?
Yeah, good afternoon, or prior to noon, everyone. Ashley McGee here, Behavioral Health Manager for the BHASO, as Justin indicated. The next topic is the Regional Opioid Investments and Opioid Abatement Council. Our OAC Administrator and Facilitator Jessica Thompson isn't able to join us today, so I'll be given the update here. I know at the last SCRILS, she provided an update and overview of our regional OAC and some of the local investments. We meet every other month with that group from individuals from participating local governments to get updates on how those funds are being utilized and talk about impacts and things as they roll out through the state. Some of those funds all of the funds are being used, are planned to be used in alignment and accordance with the One Washington MOU and the approved uses. Current funds that are going out, and there's some municipalities that have applications opening within the next week for their counties and municipalities for funds that will be expended in 2026 are being sought for in 2026, but some of those initiatives and efforts are focused on treatment services, syringe tape backs, some regarding mobile mat treatment services, navigation, street outreach. Some of our rural communities have initiated a Connect app that assists individuals in the communities with connecting to opioid resources, upstream intervention with law enforcement to target drug distribution, also incorporation of canine units, transportation to get individuals to their treatment services, opioid prevention with youth, therapeutic courts, recovery housing, and co-response services. In Spokane County, we're looking at expansion of current initiatives and treatment programs and projects that have been put forward and approved through the Board of County Commissioners, such as our STAT program, Sobering, Triage, and Transition Services. With joint partnerships, the city is also joining us in that endeavor to be able to expand the current capacity for treatment services to be provided in that. We are still working diligently on efforts to build out a crisis relief and sobering center that will be in alignment with our Spokane Stabilization Center here in Spokane to expand the scope of services and continuum of care that can be offered. And that is where some of those funds are currently being utilized or planned for utilization within our regional partners on the OAC. Anything you want to add to that, Justin?
No, only that as we continue to make that information available, you can find it on our webpage. There is a lot of information that is out there. And I know that's been an ongoing topic across the state on how dollars are being utilized. I can say with in direct appreciation to our region and the participating local governments and the municipalities that have joined us on the OAC, the intent and purpose for the use of these funds have been to go out to individuals. So it's been really great to hear that. And we've been able to coordinate a lot of these efforts so that as a regional response to the challenge we're experiencing, we are not duplicating efforts, but really looking to fill gaps and maintain that funding, looking at really program viability. If anything, the current budget and economic climate that we're facing only emphasizes the need to ensure that any programs we put in place can be made to be sustainable for the long term, so we benefit the community of those investments. So really appreciate that, really appreciate all the local governments and their representatives and the continued support of the municipalities and elected officials as we move towards providing these critically needed services.
Any questions or comments regarding that topic?
It's Robert Rosenkrantz. The point that Justin just made is really critical, that from a decision-making perspective, having confidence that the service that's being proposed for funding is a discrete service that isn't a duplication of other services that are out there. And it's hard to know whether services that are proposed are already available but not accessed. So Justin's point was right on the mark.
Thank you, Commissioner. Yeah, we try to focus those conversations and maintain that level of scrutiny every time a service or a program or anything comes forward. And I think our region does a wonderful job. And we do a wonderful job of reporting that information out on how it's being utilized. Not every region does it that same way. Ours is very transparent. I think that's a necessary component to the public and their trust in how we utilize the funds. So again, we looked at our website. Again, it is not the prettiest and or sexiest website, but it certainly provides the necessary information and how the funds are being utilized. So the most recent ones for 2024 have been posted.
Or are being posted.
Are being
in the
posted. We're still waiting on some municipalities, and then the upcoming 2025 ones will also be made available. But the meeting minutes for the discussion of those are also available on that webpage. So, questions?
Nothing further. I'll jump to our next agenda topic, which is just our quarterly updates from the ASO. And I know we have indicated on here crisis system updates. Some of those updates Justin and Jan spoke to earlier in the meeting as it pertains to the approach and the integration of 988 and RCL being with one provider within our regional service area. With that, in Spokane region, we have continued to move forward with a streamlined approach for dispatch and deployment in alignment with HCA and DOH and their joint policy statement for the future state of 988 and RCLs. And so we do have the crisis response triage and mobile dispatch coordination unit, which is a mouthful. MDU is the short terminology that we've been utilizing for that. And that team has been building up since December and was able to go 24/7 operational at the end of May here. And so we're looking forward to continuing to streamline that approach for response out to the community. And of course, that still means that 988 RCL numbers, there's no wrong door. Both numbers can be called and utilized. But as Jan indicated, we are starting to see more utilization of 988 as we've incorporated these other components for dispatch and deployment. So that's one update that I just wanted to touch base on as we've been progressing with that. The next one is relates to endorsed mobile rapid response crisis teams. That's something that we've talked about previously here, and that has been moving forward on a statewide level with applications for endorsed teams going live in January for the hope of being endorsed in July. In the Spokane regional service area, we had one team that applied for endorsement, and that was through Frontier Behavioral Health, who's been diligently going through the application process for endorsement. The plan from the state was to have those teams endorsed around the July 1st, with some of the processes needing to take place through that endorsement and all of the stakeholders involved in that, from the state, CMS, MCOs, ASOs, and the providers themselves. There does appear there will be a slight delay in when those endorsements will go out, and we're still working with the state to get final confirmation on that. The purpose of those teams is to be dispatched through 988 for more rapid deployment into our communities. There's certain time requirements that teams can have some incentive to meet faster time requirements and respond to urgent behavioral health emergencies within our community. So we're looking forward to continuing those efforts with our provider that has applied and with all of our providers as it pertains to mobile rapid response crisis services in our region. And with that, on another note, as we kind of briefly discussed 988, I'll also say that we've been keeping our eye and keeping apprised of the conversation and being involved in the conversation as it relates to the build out of 988. There's a lot of plans incorporated in that, such as build out of a tech platform. And so that's been a hot topic across the state as the state's been looking at the best way to approach that and soliciting feedback from providers to get a better sense of that. And so I don't have any updates at this point in time to bring forward, but that's something that possibly DOH will be able to speak on in September, or we can bring further information in the future. Any questions or anything I missed that you want to cover, Justin?
No, I think that was pretty succinct. There's a lot, as we've discussed, things going on this year to implement. And the good news is, as it pertains to how we fund behavioral services for our 6-county region, we continue to be able to fund at the level that the state has provided as well. I mean, historically, the state has funded and provided. And we've been able to weather the challenging environment, including paying back additional funds that were not allocated out. So being both responsible to the state and giving back the money for unused funds in very specific proviso areas, but still ensuring the ongoing commitment to existing services. So that's good news for our region. Second part is to Jason and his team's update as well, that existing funding that we have there, the legislature has provided to us. They've also maintained that. So that's, again, thankful to the legislature and for the Healthcare Authority to continue to support that and fund us. The third area is, although we recognize that there could be impacts to the Medicaid services, Spokane County Region still ensures coverage in a voluntary basis for all non-Medicaid people, and those that may have lost their coverage are no longer eligible based on current eligibility criteria for our region. So that's a benefit that our region provides, and that has not changed. So we'll continue to do that, continue to work with our regional partners in building out resources. But we're very happy and proud of that and the continued funding to be at a level. So not all doom and gloom, a lot of good things about that to our region and planning, but a lot of things to look forward to. All right. That is the end of our updates. This is the last part of the meeting where we open it up to our members. Anyone from our SCRILS membership who'd like to discuss a topic or make a comment. And before I turn it over to any open public comment, I want to open it up to our chair. Commissioner Cooney, is there anything you would like to add before we open it up to public comment?
Trying to unmute here, sorry. No, I think as you know, it's a wealth of information that we gain by all coming together and listening. So I just appreciate all the efforts of everybody that's participated today. I'll let you do the public comment and I will let you close the meeting.
Excellent, thank you. And with that, we'll open it up for first call for any public comment or input. Second call. Last call. Seeing nothing in the chat and seeing no raised hands. It is Friday and it's a beautiful day from what I can see. It's also Father's Day weekend. So this completes our meeting. Thank you all who attended and are also doing double duty at maybe the Behavioral Health Conference or on their day off like Jen was. We wish you a bright and sunny weekend. Go forth and enjoy. Thank you all. We'll see you in our next meeting in September.
Thanks so much.
Guys, have a great weekend.
You too.
Thank you. Fun hiking.
Yes. We get out of here.
Yeah, good for you. Enjoy it.